Good evening, and today we're doing rehabilitative massage or medical massage for the lumbar region. And I have Harmon here on the table who is ticklish, and I forgot. And so what you want to do first is strip down the ligament groove using your thumbs like so. And with each stroke, you want to bring it out, down, and along the top of the iliac crest down to the table. And as I go, each time I come out, I'm coming further and further out from the spine itself. So I'm taking care of all of the muscle groups that is there in that region for the erectors. And you should do this about 3 to 5 times. Then, facing the hips, from the head of the table, place the thumbs on the line of the iliac crest in the same manner and that you use to strip the laminar groove. Then move both thumbs in a cross fiber friction from medial to lateral. So what we're doing is, and I'll push this down just a little bit, so right here. So after I come down that last time, right here is where I'm at. So.
Does that hurt, Harmon?
No.
I can tell he's laughing, though. That I can tell.
It's ticklish.
Yeah. And so you're stripping along this region here, which is where the erectors and then your QL comes in and they attach here at the top of the iliac crest. All right. And then from there, while maintaining the thumb position, then what you want to do is you want to turn your body to the side. So I'll transition from here to the side. And then what I want to do is I want to strip the QLs all the way up to the lower rib, which is right here. And you'll feel it when you hit that lower rib. And then you do cross fiber friction at the attachment site for the Quadratus lumborum, and then move laterally to medial. So that's what I'm doing. Then after the stroke is complete, maintain your thumb position and then turn your body, your thumbs, to face the trunk with your thumbs, and then push in and move the thumbs upward to grasp the QL. And so if you can see my thumb, that's the QL right there. And so after you grasp the QL, let me see where I'm at there. Grasp the QL between the thumbs and the hand, and then apply friction to the muscle belly in the direction that the muscle fibers flow. And you'll do this for about 7 to 10 seconds. And so as you can see, my thumbs is in there. Yeah, separate treatment of the multifidi and the erector and the Quadratus lumborum and the attachments of the transverse process by palpating along the lateral borders of the spine in each muscle group. So, from here, what you want to do is and you can feel each group as you come up. Now, technically, I usually would transition my body this way, and then that way I'm going to end up in the sacroiliac joint. And then right here, I'm in a sacroiliac joint, 1 finger width at a time, because I came down each one of the vertebrae. And if you are a shoulder therapist, this may require you to adjust your positioning, Mia. Then when addressing the iliolumbar ligament, the elbow, because this is where we at right here. This is where the iliolumbar ligament starts, because it's that webbing. When you look in your anatomy books, in your muscular books, that webbing that goes across the entire sacrum that holds everything together in here. This is a good place for you to use your elbows. But you don't want to put too much weight on it. And the idea is to warm up these ligaments in here, because everything in here kind of gets glued together because it's not an area that gets worked very often. But once you free it up, most people are like, my hips feel a little bit better, a little bit looser, because they just don't get worked that much. Then, when addressing this ligament, like I said, you use the elbow as one of the tools in this region, and because of fascial binding. Then remember to address any scar tissue and adhesions and trigger points that you may run into in this area, because there are areas where you can get trigger points right along the very edge, which is actually in the glutes, along the edge of the iliac crest, where the glutes come up and attach to. So it's usually like here, here, and here, and then you got some that's like right in this region here of the sacrum. But what y'all just saw me do, that's it as far as the lumbar treatment is concerned. So you have the stripping, where you come down and come out. Then you have your transition, where you'll do your cross fiber friction here, bring your body around, then you will strip the QL up to the lower rib, cross fiber friction here, then reach in, class. I wasn't gonna do it, Holly. And then you grasp the QL, you'll work it out a little bit, then you'll come up and you might step over in transition and then start addressing the transverse processes to get the multiply and all of those things that are in there. Work your way all the way down into the sacroiliac joint, and then work on this iliolumbar connective tissue, this ligament that's in here. And then that's it. So not a whole lot of steps, but it's very effective when you have people who are having lower back issues. Because I didn't apply a whole lot of pressure, but you can see the ischemia.
Yeah.
In this skin. All right, and that's it for the lumbar treatment.